Top of the day to you. This is Esther Davis. We're in a new location today because we've been asked several times about how about Dallas County? What is Dallas County doing with the virus? So we have the top man in Dallas County to talk about health, to talk about the COVID-19, and especially about health in the African American community. I know what you've heard on the televisions over the last television stations for the last 8 or 9 months, but in Dallas County, because Dallas is such the 8th largest city, 8th or 9th largest city in the United States, we want to talk to Dr. Huang, especially about African American health, which is African American health. How you doing over there?
Good, good. How are you?
Thank you so much for your time.
Sure. My pleasure.
And I think your offices are great. Thank you for all of the information that's up here. I really want to start with the COVID-19. What position do you think the county is in right now?
Well, unfortunately, we just went from orange to red in terms of our risk level as a community. We had started out at red for many months. We never saw that 14 days of decline that everyone said we needed to see before we started opening things up. You know, at the state level, then the governor had opened things up, I think, prematurely, and then we saw a dramatic increase in things. Memorial Day was when we, there was the worst.
That's what we spiked.
That was, yeah, we really spiked. And we got to July 4th and we said we cannot see another Memorial Day weekend over the July 4th weekend. But then that week right before July 4th is when we're able to get a mask order requiring masks. They closed the bars, the governor closed the bars, and we saw a decline in all of our numbers then after that. And we showed that we can make an impact on this by doing these things that we know work.
Right.
Unfortunately, we had plateaued and got a little spike around Labor Day. And then now the last 3 weeks, we've seen consistent increases back in some of the hospital numbers. And so just 2 days ago, we went back from being at the orange level back up to the red level. So, we're all very concerned, but it's all up to us. We know what works. We know these things work. We know keeping the 6-foot physical distancing. We know washing hands. All of that will work, but we have to do it. And we can't let up. We have to be vigilant. If we all do it, it makes a difference. But, part of the numbers going up, we've had schools starting back, we've had colleges starting back.
And we got a slight bit of a tick up in Dallas County right now.
Right. Well, that's what this tick up is now causing, why we went from orange back to red.
Okay.
And so it's just, we need to keep the message out. We cannot let up. And you can't let up for a bit. That's the thing. We have to stay vigilant because that's what you hear from people. Well, I just did it this one time.
Right.
And then they want to, look at the highest levels of our government where they're doing testing of these people supposedly every day or however, and they still had it. And it shows how vigilant you can't be. That's why I'm stickler about some of this. We have to do this.
We don't care.
That's what it takes for us to control it. And it's when we let our guard down that then it,
Have you ever lived through a pandemic in your career? Have you lived through a pandemic in your career?
No, this is, it's...
First one in 100 years.
Yeah.
On the African American
we had H1N1. We had H1N1.
That's true. Ebola was not as big in the United States.
Really, but so I've gone through that.
In the African American community, we're having a serious problem. Let me just tell you a couple of statistics that came out of our sessions with the African American nurses. Dallas County has, I don't know how many retired nurses we have, but I had 8 in a group. And we did about 4 800 number conversation sessions. And one of those nurses was a 21-year veteran from the Navy medical world. So her information became very valuable because she had been in pandemics, in spurts across the world. In the African American community, we're talking about, every station talks about, we are the #1 people that are disproportionately replaced. Now, I want to know your thoughts about that. And then secondly, I want to know what it is that can be done to curtail that.
Sure. Absolutely top priority, as well as the Hispanic population. What we've seen locally is both groups disproportionately affected, but in particular, actually, we've had even higher rates and higher disproportion in Hispanic members, families, but it's all related to some of the same disparities that occur with other conditions besides COVID that we've been looking at with our community health needs assessment that identified these disparities, health disparities when you look at cancer, you look at heart disease, you look at asthma.
Those are the underlying
all
conditions.
the same things. Yes. But those same underlying conditions make people more vulnerable to COVID. In particular, frontline essential workers have been very disproportionately affected. That's where we've seen these disparities, and then also some of the household, when there are more members, multi-generational members in the same household. Right. So we've seen a lot with one person gets, infected in the family, then it spreads through the household. And then, the people that are at the essential frontline workers aren't able to telework like other people might be, at higher white-collar jobs might be able to telework. They have more pressure.
Telework, what is telework?
To work from remotely, to not have to go to work.
Okay.
If you're a frontline essential worker, you can't do it by Zoom or something like that,
Exactly.
and then, and so, you can't do that. And there's more pressures also that you need to feed your family. You can't take off work. When we say, if you're sick, stay home, well, sometimes there are more pressures that they're not able to stay home.
Exactly.
And so all of these, factors are, we certainly recognize are issues that we're trying to address, and not just in times of COVID.
Well, I want you to know our focus group does not think Dallas County is doing enough for African Americans, especially if you have these large statistics, not only in Dallas County, but in San Francisco and Atlanta. If we have a tick up in the African American community, what are we going to do, and what do you think needs to be done with that? Can we have an outreach session? Can you invite us back to your offices and talk about what they're talking about? This is another important point too, Dr. Huang. Most of these retired nurses were from major churches in our community. I did not realize that we had newsletters in some of our major churches. So I started talking to some of the pastors. Okay, what are you going to do? Can I put this message in your paper? But I need to hear your thoughts on what can we do to, in the African American community, because that's my focus right now,
Sure.
with the underlying conditions.
Yeah.
What can we do? Can we have an outreach session? Can we have more information with the black press on something that comes from the people in that community? That's really, really important.
Absolutely.
What are your thoughts about that?
Absolutely, and I personally have been on a couple of, they were Zoom meetings with the African American pastors. There's several prominent pastors in the community that have been leading efforts, and I know have been working also with Judge Jenkins on that. Again, I personally have been on at least 2 of those large sessions where they had all of the black pastors in the community to talk about COVID. And what has been encouraging is that the relationship, and I know the pastors have worked well with the judge, with commissioners, Commissioner Price and others, that early on, even when at the state level, when they said, hey, churches can open up, and the pastors here did not open up, and they've not been opening up. And on this talk the Zoom I did just probably a week and a half ago, they said they're still waiting.
What are they waiting for?
They're waiting for it to be safe.
Okay.
They're waiting. They are listening to the guidance that's coming from. We have had this guidance document that has, from infectious disease, epidemiology, public health experts. And we said, because the state opened up these things and said, churches, you can go ahead and do anything you want. And so they took away local ability to say, no, you can't.
Right.
But what, at the local level, we've been saying, just because you can doesn't mean you should. And so we've been putting out, okay, the governor's opening these things up. Here's what our experts think you should do. You can, it's legal. And just because you can doesn't mean you should. And what's been encouraging is the pastors in our community have not opened up.
Do you think we should have had a national mandate for a global pandemic?
Yeah, I mean, absolutely. There needs to be consistent messaging. I think it undermines the efforts when there are mixed messages coming from the federal level that do masks really work, or making fun of masks, or, again, these mixed messages about what works. And as we were saying at the beginning, I mean, it also shows how at the highest level of government, where there should be as much protections, and they should know better. I mean, there's clusters of illness occurring in these groups.
True.
And so that's why, and we know how to prevent it, and that's why it's imperative for all of us to not let up and have to be vigilant. But if we do this, we can prevent it. And it's protecting our community. That's what we need to do to protect our community. And there was even an editorial in today's Dallas Morning News.
I saw that.
That said, we know what to do. We just have to do it. But I will say, if you look at our numbers, our African American community has done better than many others in other communities.
But there are also some African American communities that have done better.
Well, I think our community has done very, again, talking to the pastors, I have so encouraged, so inspired that they have been saying and have been listening to the guidance and said, we are listening to you. We're not opening up. We are trying to protect the community, and they have. I mean, again, it's not good for any of us, but I'm proud of what has been done in the community. There's much more to do, obviously.
We have a lot more to get done. And what happens in our community, Dr. Huang, is that pastors do a great job. I belong to a Baptist church. I go to church. I participate in church. The biggest thing that we have, people are going to listen to the black pastor, but they're also going to listen to the black media. I'm always surprised at, we have 7 black papers in the Southern Sector, 7. And most of them have been there 30, 35 years. So they're credible people. People are going to listen and pick up that paper. They'll pick it up at church, they pick it up at Luby's, they pick it up at the places eat. I would like to see, and I want to know what you think about, the pastors are one part, integral part, politicians are another part, but that's a small, in my opinion, and I'll say that again if I have to, that's a small percentage. Our papers carry more weight than our pastors, because in America, church attendance is down 40%. In a barbecue place like Records, have you ever heard of Records Barbecue? Records Barbecue, Rudy's Chicken. These are places that are open all night, open long hours. People are in and out buying stuff. And they will pick up a paper. And they will read the paper. They won't go to church. So we need more exposure. And I just want to know what you think about that.
Oh, absolutely.
It would help.
Yeah,
Let me tell you, I can't tell you how much that would move Dallas County. You know what I call Dallas? I've traveled internationally for the last couple of years. I call Dallas the center of the universe. Because a lot of other cities emulate what we do here. But what are your thoughts about that?
Absolutely. I mean, if there are any suggestions on how to reach the community, since I've gotten here, I've created a brand new community outreach position. And we've been trying to, that's their goal, that's their whole effort, is to be doing community outreach. At the start, and from the start of this, they've been out in the community, on the ground level, putting up posters about COVID-19, putting up about masks, working with shop owners on how to effectively do the physical distancing, how to implement the infection control things that we've been, they were featured on the front page of the morning news, earlier on, because, and for all our efforts, not just COVID, again, that's one of the reasons I wanted to create that section, because being on the ground is so important. So we're trying to coordinate, and if you have any other contact, like we're trying to engage youth also. So we have now partnered, and we're a sponsor for Sunset High School P-Tech.
Okay.
So that's a program that the kids can, when they graduate high school, it's coordinated with UNT Dallas and Dallas County Community College, that they can get an associate's degree when they graduate from high school.
Absolutely.
And they have a concentration in public health. So we have adopted them. We are their sponsor. We are working with these kids to try to, they're the future. And we're trying, now COVID has disrupted some of the activities we've been trying to do, but that is the start exactly to be in the community, to work with these churches. We're working, like one community outreach that we did last year, we're trying to replicate and expand. We were working with UT Southwestern. So they worked with the high school on flu shots. And so they got the kids to mobilize the families and parents to come for flu shots. And so did one event at this height, and they had 400 flu shots administered to all the family members, that many of them had never had a flu shot. And so any ideas on how to mobilize the community is exactly tying in with what we want to do, what I want to do. We've had initiatives with HIV and the whole...
Yeah, I saw that somewhere in the room here.
We have a whole End the Epidemic initiative. And some of the top high priority zip codes, South Dallas, Southeast Dallas, and working on, there's some specific goals. There's a 90-90-90 by 2030 goal, so that 90% of persons who have HIV know their status, so that's getting tested. 90% of those persons are then on sustained treatment. And then 90% of those persons on sustained treatment are virally suppressed. Because we have medications now that if they're on treatment, their viral load can be suppressed, so they can live a normal life. They can... Explain
to me viral suppressed.
So it means you take the medication and it's like you don't have HIV. You should still practice safe sex and things, but you then are no longer, that breaks that transmission cycle further to transmitting. And so one of our top priority areas is African American men, men who have sex with men, African American men who have, also the transgender population. And those are part of our initiatives, and we've gotten some fun to try to do more innovative ways to outreach, because how do we get people tested? But then also sometimes they get the status and they don't follow up with treatment. How do we make the connections so that people will get treatment, stay on treatment? We have resources, and they're community resources that we're trying to get them, and then if they get lost, if they come off treatment and stop for some reason, how do we get them back on and keep them on that so that they're virally suppressed? And so, absolutely, like for that particular initiative, Black MSMs, men who have sex with men, are some of our top priority populations, because when we look at the data. And so we're also trying to work very closely with Parkland Hospital, because Parkland serves a lot of the same population. They have the resources for treatment. And we're really trying to, I mentioned the community health needs assessment. And that was a joint effort that we looked at the data, and that's where, some of the disparity between the zip codes that have the lowest life expectancy versus the highest. And the lowest life expectancy are in the areas of South and Southeast Dallas versus the highest.
Correct.
It's like a 23-year difference in life expectancy. And so absolutely, we are trying to use the data. Here's how we can partner. Public health, one of our core things is getting information. We don't treat patients individually as much, but we treat the whole community. So one of our key things that we do that everyone else doesn't is get all the information. So we look at the death records, the birth records. We get all the COVID cases.
Right.
We get all the conditions and the data for all these different diseases, and not just for one hospital, but for the whole community. So we look at that, and we're trying to then use that information strategically with Parkland. So they have their community-oriented primary care sites that are out in the community providing services. But how do we then best fit in with them and complement what they're doing? So like with immunizations and flu shots, if they're doing some, what are the populations that they're missing?
Right.
And how do we work with them so we optimize together?
And you have people that will go into these communities.
Yeah, and that's what we're trying to expand, and other strategies. And so the newspapers sound like a great...
The newspapers are a great idea, and the other thing in the African American community are what I call community royalty. These are people that are not pastors, they are not politicians. They're retired school teachers, Dr. Huang. They're retired precinct chairs. I did a story one time on women that had raised 10 children. I can't tell you how popular that whole thing was. To raise 10 kids, you do need that kind of notoriety.
Yeah.
In any event, in the African American community, we have people that other people go to. I have young people on my staff, and we have young interns that are in mass communication. This young lady has 4 generations in her family. Her grandmother is still living. And so we need to recognize our community royalty, those people that speak to the ones that are not going to go to church, the ones that are not going to, maybe they didn't finish high school, they didn't go to college. And we recognize fully that we have a legitimate middle class. But our problems with the virus and with HIV is in the middle to lower categories.
Sure, no, absolutely.
So it depends. I'm so happy you met with us today. This is absolutely
No.
we're honored.
I mean,
that
no,
you
this is great. I mean,
spend
if
this
you've
much time
got
with
more
me.
connections and more, I mean, absolutely, we want to use those channels. That's what we, you know, and want to use those networks in the best way. We work with a lot of churches, and we try to do a lot of activities with churches. But if there are other communication channels,
Oh, you got
yeah,
several. You got so
absolutely,
many.
we want to do that.
And you have the new people that are moving in to our communities, and they're coming into the southern sector. But what else? You just mentioned, I've got a few more minutes with you. I want to stay on time. You just mentioned a lot of things that are going on with the virus. How do you connect? Where is the pandemic going? That's a better question.
Well, right now, again, unfortunately, the numbers are going back up. And, you know, and as we mentioned, the editorial said, we know what to do, we just have to do it. But it's hard. Human nature, people get tired of this. Now they're trying to open up the bars. You know, we're not doing it in Dallas County, but then they've actually been getting around it.
They're
If
just
they
going to
start
go
serving food,
to a bar.
yeah, well, I mean,
all
they start
this
selling
stuff.
food over 50% of their sales, and they can count as a restaurant or something. And so there are ways that people are working around this. And you know, again, if everyone would do the mask and stay separated and not, you know, and be vigilant and not go to these bars, and that's why with the bars are extra. We understand, we want people to be able to make a living and so if there are safe ways to do that, and that's what we figured out some things, if people will do this, but how do you do that? You know, I mean, with restaurants, restaurants can keep in business and keep doing drive-through and takeout or curbside, and that's great. And some of them are doing actually very well with that. I mean, I've seen that some of them have been able to, you know, it's actually less time that they can process a whole lot of people through because, and not have to have them sit at tables and so some, you know, and so there are new ways that people are finding out how to do things. We have to figure that out. We want everyone to be able to be successful, but to do it in a safe way. And that's what it takes. Again, it takes that vigilance. We cannot let up. Now, I know all of us want to have family members come over for the Sunday picnic or something, you know, and we can't let our guard down. We have to understand if we do that, then we can get this enter into our family, and then it spreads. And I mean, if you see, hear these stories. I mean, I know there was just a story on one of the news stations this week. This guy who was, one of the oh, this is a hoax, I don't believe it. He talked his family into doing this one birthday celebration or something like that, and his family members came out, and he's the one who talked him into it, and they let their guard down, and then it spread through this whole family, multi-generational. His father-in-law died.
Yes.
And it's a tragedy, but we know how to prevent it, but it's hard, but it's as a community, and for us, and personally, again, we have to make some of these sacrifices and figure out how to do it safely. If you stay in your family cluster, or, if we do more, remote video conferencing, you can do even in person if small, but if you really stay this 6 feet apart,
Yes.
and you wear the mask. Now, it's hard for people, but if they'll do it, if and still not do big groups. But that's where you've got balance between human nature and what really happens if you bring people together.
Are you having Thanksgiving dinner with your family? Just
No, probably. It'll be my immediate people that I stay around,
okay.
and it's not, any big.
Hospital beds. My final question is hospital beds. Are we prepared for a second spike?
Everyone, in terms of hospital beds, the hospitals have a surge plan that they can convert, old, surgical recovery areas into ICU beds. They can stop elective surgeries. They can convert various areas. We never had to kick into that yet. They are looking at their current, capacity, like Parkland. They've got single bed rooms. They can double them. They can start putting 2 people into every room.
So we have a lot of options.
There's a lot of options that they looked at, and they have those plans. We don't want to get there. We don't want to be pushing our surge, but there is a plan for increasing capacity.
Would you spend some more time with me in the next couple of months?
Oh, absolutely. No, I would love to. I really want to connect with you. Let's get some of the community outreach ideas, partnerships, because we've got a lot of initiatives, whether COVID, whether asthma, whether diabetes, HIV and STIs. We are absolutely trying to do that. We want to work with community partners, with Parkland, with other community-based organizations. You should be part of, we have a whole Ending the Epidemic Fast Track County initiative.
Fast Track County
Initiative to end the HIV.
Where is your newsletter? Where is this information? The Dallas Morning News is one newspaper, and I have to say this. In the African American community, our viewership or readership with the Morning News is nil to none. We're going to pick up the Dallas Post-Tribune. We're going to pick up the black newspapers. So that's the first thing I'll talk to you about. The second thing would be...
now, is that only paid advertisement, or is it just stories and things?
Oh, it's going to be some paid advertising. These are black.
Okay. But do they do stories? Do they do
true,
news
that's
stories?
True. They're true stories, and they're influencers to these stories. I'll give you one example. Molly Bell's paper. I'll use her paper. Her dad was an attorney in the neighborhood. And I'm talking about longevity, credibility, branding. They're going to pick up the Dallas Examiner. We got 4 generations that would pick up that paper. Dr. Lee's paper is called the Dallas Post-Tribune. Retired principal in the African American community. They're going to pick up that paper.
Sure.
So those are the connections. And our community, I think, is about branding and about legends.
Sure.
Pastors are wonderful, but I don't put pastors at the top.
Sure. Okay. Are there reporters that
There
do
are.
stories?
I can bring. I'm going to talk to you about reporters. I would like to have an opinion session with the retired nurses, because the retired nurses have been through several of these, and then they go home and take care of a loved one.
Sure.
That kind of a thing. They're going to have so much information, you won't have time to absorb it all.
Yeah, no, that's...
So those are my 2 priorities.
Absolutely. No, let's speak the dialogue up. That would be great.
I so appreciate your time.
Thank you so much.
Thank you so much. This is Esther Davis. This mask has been giving me a headache, I want you to know, but that's what we have to do. You have to wear the mask. It's been a great session with Dr. Huang. Thank you for all your time, and as usual, you're the greatest audience in the world. We'll see you next time.
Good afternoon, good morning, good evening, wherever you are out in the world and our land here in America. This is Dr. Fred Jones, up front with Fred Jones. I'm also representing the EDTV, Esther Davis Show. And today, we just had a very, very interesting poignant questioning and answer session with Dr. Huang, who is the Director of Dallas County Health and Services here in Dallas County. And Dr. Davis posed some very interesting questions that we need to hear and we need to have. And the main thing that she was posing was, what is Dallas County doing with COVID-19 testing, tracing? How is COVID-19 being addressed? What is the county's position on bars, restaurants being open? And finally, how can we get more involved with helping Dallas County to understand what's going on in the black and brown community? So what I got out of this is that Dr. Huang is very, very open to new suggestions and new ideas. The other thing is that the mask work. We have been reducing, but we are spiking up again because we keep going not wearing our mask, and we keep doing things that are causing some problems in the community. So we have to continue to wear the mask. We have to continue to do those things. And as you can see, my mask is giving me kind of the blues, but that's part of the deal, y'all. We just have to do this. Because if we don't do it, we're right now getting spiking back up to red again. Parkland Hospital, the beds are starting to fill up again. We got flu season coming up. We're losing our generations. We have to make sure that we do these things. Thanks to Esther Davis, also to C.W. Whitaker, and Miss Jasmine. We're going to be focusing in on our social media. We're going to be focusing in on our YouTube program, so make sure you go to YouTube to catch us so that you can keep up with the information. We're going to be hitting the black newspapers, the black press. We're going to get the information out there to you. Pulling on my mask once again because this is just what it's all about. When we wear our mask, it causes a little distraction, causes a little discomfort, but it keeps us safe. I keep you safe because I have my mask on. Do not underestimate the importance of wearing your mask. Do not underestimate the importance of small gatherings. Do not underestimate the importance that this virus is not going anywhere fast. We have to be vigilant, and that's what we're going to do. We're going to give you the information. We're going to make sure that you keep up to date, and we're going to keep you knowledgeable. The rest is up to you. It's Dr. Fred Jones speaking. Listen, YouTube TV, EDTV. Check us out on Instagram, Twitter, Facebook. You're going to get your information. If you don't follow it, it's on you.